Maureen, welcome to the Center for Global Development. My name is Javier Guzman, and it is a pleasure to welcome you today to this event called Shaping the Future of Global Health Supply Chains. It is a pleasure to have such a esteemed panel today. And I want to say a few words before we get started. We are here to launch a forward-looking position paper entitled Ensuring Future Fit, Global Health Procurement and Supply Chains by 2040. That work explores the impact of global shifts on existing supply chain programs and discusses strategic investments that ensure resilience, sustainability, and equitable access to essential health products. The work was done last year, but as we gather today, we all know that we are going through a pivotal moment. Some people call it the poly-crisis for global health. We have major aid cuts, fiscal tightening in many low and middle income countries, growing calls to imagine global health financing. So the pressure on health systems, the pressure on supply chains is massive. We're still learning, the lessons from the recent pandemic from COVID-19. And we see how the pandemic exposed a lot of the limitations of the supply chain, from fragmentation to fragility to concentration. So it's a very interesting moment because the work that was done last year does really inform the present and the future. So as we look at the future, we need to look at, more than just a quick technical fix. And that is what the conversation today is about. So welcome again. I'll introduce first a presenter. We'll have a presentation for 10 minutes or so. Then we'll have a panel, and then we'll open up for questions and answers. So please do send us your questions. We want to hear from you. So our presenter today is Prashant Yavat. He is a former CGD fellow. It is a pleasure to welcome him back to CGD. And he's also now a senior fellow at the Council on Foreign Relations. Welcome, Prashant. Then we have 4 esteemed panelists. We have Seife Demisi, who is the Director of Pharmaceutical Supply and Service at the Addis Ababa City Administration Health Bureau. We have Philip Kalpaxis, who is the Principal Procurement Specialist at the Asian Development Bank. Lombe Kasonde, a Senior Health Specialist at the World Bank. And last but not least, we have Niamh Magna, who is a Procurement and Supply Chain Management Strategist and Development Advisor. So thank you all very much for joining me today, and thank you to our panelists. So first, Prashant, over to you for a short presentation.
Thank you, Javier. And like Javier said, I'm a CGD alum. What we are presenting today is work that was done when I was at the Center for Global Development. It's a great pleasure to present this paper on behalf of my 4 co-authors who are going to be panelists. I want to make sure that I represent what's been captured in this paper succinctly and also precisely, not to add my opinions and viewpoints. So what I will do is share my opinions and viewpoints as a preface, and then move on to presenting what are the key tenets in this paper. Those of you who are joining, if you haven't read this paper, I would encourage, it's a short read, its link and ways to access it will be made available if they haven't been. And I will not do justice to a paper that is about 10-12 pages in a short 10-minute presentation, but I want to focus on things which I believe me and my co-authors think might be the most important to jumpstart a conversation on this topic. I will use the help of a few slides. So give me a second to bring them up. Here they are. Okay, so I want to start by many of you have thought about supply chains. If you work on supply chains for health products anywhere in the world, future-looking scenario planning is not a new exercise for you. So we don't want to claim we are, and this paper is by any means the only exercise that looks at the future of supply chains, in particular for healthcare products in low and middle income countries. But we also realize that many of us have very pressing day jobs. We end up thinking about the future in a somewhat ad hoc manner because that's not something we are given the luxury of doing systematically. So a few of us got together. This is a paper from a couple of years ago. There was a workshop in October of 2023, and there was a follow-on workshop in March of 2024, which brought together a group of people. So while this hasn't been peer-reviewed in the strictest sense, what this paper has achieved is inputs and comments from a large and somewhat diverse set of experts besides the four of us who wrote this. And those have been incorporated to some degree in what you're going to see. The second thing I want to mention is it may appear that a paper that was written in October 2023, a lot has changed, right? And people may claim that the architecture for how aid financing works, in particular from the United States, has changed. There are other developments on the horizon. So does this paper and what you guys had then discussed and outlined still make sense? And the answer is, from our standpoint, is yes. But you all will tell us if there are the key components and things that we failed to capture, which have only become vivid in the last few months to you. And that's where, we can have a longer discussion at some point. I also want to start by a definitional question, which is, again, my opinion. When I think of supply chain management, and I've been a professor at different academic institutions, which at times have been pioneers of starting graduate programs in supply chain management, our definition and what is the commonly accepted definition of supply chain management is something that starts from when manufacturers source input material for production and goes on to the time when the product is finally made available to the end customer. So it includes manufacturing, sourcing for manufacturing, purchasing, international logistics, and in-country distribution. Somehow in what we commonly call as the global health supply chain community, the definition of supply chain has become what happens in distribution and international logistics, and manufacturing and procurement has been left out to be a separate bucket. I do not believe in that segmentation, irrespective of how organizational structures across global health agencies may have been designed to separate procurement from supply chains. That's one key aspect that we have to keep in mind. And some of the things that you will see in this paper will hopefully make the case, or somewhat more compelling case, on why this should be a common end-to-end view. And the last thing as preface is supply chain management has reached the CEO, the chief executive agenda across companies in the last 5 years. Javier mentioned the COVID-19 pandemic, other developments that have happened, policy changes happening currently. All of them have brought supply chain management to be something that is high on the chief executive officer's agenda across firms globally. Every single company CEO now pays attention and has a chief supply chain officer who report directly to them. Somehow, we haven't come up to a same level of importance for supply chain management amongst agencies, organizations, ministries, and actors who work on healthcare supply chain, or who work on healthcare more broadly. So it has to be on the chief executive's agenda fully and systematically, as it has happened across firms. Those are preface points. Those are not necessarily what are reflected in the paper. But now to the paper. So what we tried to do was ask a question to both ourselves, look at literature, and ask colleagues and experts, what are the most important forces that are changing in the overall landscape? And from those forces, which are the ones that will have the greatest impact on the design and operation of healthcare supply chains in low and middle income countries? Can we take that subset, get a little bit more deeper into what those global forces are, categorize them into 4 or 5 buckets so that it's easier to communicate, easier for us to understand, and then from those forces, ask the question, what impact, what specific kind of impact will they have on supply chain design and operation? I'm stressing both design and operation. And then from there, ask the question, what should we be doing? Right? And we have to accept the fact that how will the future unfold will always remain uncertain. This is by no means an attempt to predict the future trends or future macro trends. It is an attempt to say what are trends that are already in play. And therefore, if those trends change, which they very well might in the next 15 years, can we be designing our recommendations or ideas for action from this paper to be such that they are what we would call as no regrets moves, which means things which, irrespective of what happens, would still be salient, important, and relevant. So the kinds of things that we looked at, which were the most important global forces, the first was population dynamics in multiple dimensions. The first being where will population growth occur? Where will young and old people live in the future? What will the patterns of migration be? When I say migration, I'm referring to urban-rural migration. We know from data that there is a great urbanization that is happening. So we looked at trends like that in population shifts. We also looked at changes in disease shifts, and CGD has in the past done a broad body of work on what they call as the triple transition, which got into the fact that the shift from infectious diseases to non-communicable diseases occurred in developed or high-income countries somewhat more cleanly, whereas in low and middle-income countries, the infectious disease burden hasn't come down, while simultaneously the NCD burden has gone up. So in some ways, they are facing a double whammy. So we looked at issues like that. We also looked at population preferences, which means people are changing their preferences in how, where do they want to seek healthcare. Then we looked at climate change and its many different impacts on the supply chain, not just the fact that logistics, transport, and distribution contribute to carbon emissions in some non-trivial manner, but also things such as the impact of the types of products, the impact on health emergencies, the impact on how health facilities and potential impact of climate disasters on health facilities and supply chain assets themselves. The third thing which stood out is new technology of various types, digital technology for the provision of basic information in supply chain management, new transport technology such as drones for delivering at the last mile, also in some cases at the middle mile, other technology which eases the tasks for healthcare professionals and for supply chain professionals at the front line, such as new forecasting technology, the use of new analytical techniques, AI, all of that as a key global force or a global trend. And then the last, but in some ways the most important, given the juncture we are at today, is how is macroeconomics and where does money come from change for global health supply chains? And this is something which we looked at in some detail to ask, because the ability of many of the LMICs in paying a larger portion for their budget seems to be increasing, not in a somewhat direct manner. Sometimes it goes up and down, fiscal space changes and so on, but at least there is an overall trend that, yes, the ability to pay is increasing. In addition, there are pockets of the population who are currently paying out of pocket. Some of them are the poorest socioeconomic quintile, so we want to organize the market better for them, but some indeed are affluent and are paying out of pocket, and we can't completely neglect the out-of-pocket market. We also looked at things such as improving infrastructure. Many of the global supply chains were designed in LMICs with an assumption that infrastructure, and by infrastructure I mean both technology infrastructure and physical infrastructure, the availability of the internet, the availability of broadband, the availability of roads, rail, air transport, new ports, new airport capabilities, the transit times at some of the more advanced airports that have come up in LMICs coming down significantly. So those were other factors we looked at. This was a core part of where the group spent time and also where we got a lot of input and ideas. Then from there, I'll jump straight to 5 ideas for action that we came up with. The first one is, traditionally, the task given to supply chain designers, which many of us who are joining are, was here are a set of clinics, here are a set of products, and you make sure you can get these products to these clinics. Right? That's the model of somewhat passive supply chain design that we imbibed and continue to operate with. I think our first recommendation is to expand the boundary of supply chain design and ask the question, don't tell us these are the only places to serve and stock. Let's ask the question, where do the patients start their journey of seeking healthcare? And what are the best points to provide them health products in that journey? Is it at the community? Is it in a private pharmacy? Is it somewhere in between? Or is it at home? Or in many, many cases, at a primary health center, which is publicly owned, right? So starting from the bottom and asking, where does the patient start their journey? What can be done? The second is a lot of technology is being thrown at country managers, in particular, colleagues in ministries of health. This is a great technology, use it, start using it in a more mainstream manner in your health system. And the country managers are somewhat overwhelmed. It's not straightforward for them to say, should I use this in my health system? Will it create value for me? Yes, no. And then both parties are unhappy in this because those who develop the new technology are saying, I've spent a great degree of my career in building this, but no one is having an uptake for it in the countries where I designed this for. Countries are saying, we tried 1 or 2 and it doesn't give us the value. So designing a system where we can assess technology in a better way, its value to the health system, in particular supply chain technology here, that's a second recommendation or idea for action. The third one is a lot will change, as we've seen in the last few months, and a lot will continue to change because that's just the nature of how supply chains have to be designed to operate. And here our key recommendation was the function of risk management amongst global health agencies and their supply chain units is usually an afterthought or not necessarily given the importance that should be. So the idea here was, can we make sure that planning, and in particular scenario planning and risk management for resilience are done more systematically. They are organized as a better unit in agencies and in ministries of health, and they are given resourcing for carrying out this task. Fourth action item was a lot of the supply chain management for health products in LMICs is a very busy space. Lots of different actors, agencies, funders, NGOs, government counterparts, and private companies. And there is a lot that keeps happening in this busy space. And so the idea was, can we be better coordinated and can we organize the coordination function in a better manner with transparent sharing of information, designing projects that have co-financing appropriately matched and laid out. So that's the fourth. And the last was, there was a lot of discussion about local procurement and localization of different activities in the supply chain, including manufacturing of health products, but also local, regional, sub-regional procurement models and what will they do to the supply chain design. So those were the key ideas. I think in terms of specifics, we say, especially around the one which is on patient-centric supply chain design, agencies, governments should start by gathering data and carrying out analytics on it to understand the patient journey. and where the current supply chain's footprint is. And that matching will tell us where the gaps lie. And that will then lead to a better discussion about what should be the state of supply chain. We have similar, more specific action items for each of these 5 areas, which I recommend you to look at the paper. With that, I pause and hand it back over to Javier.
Thank you very much, Prashant. That was very interesting. Thank you for summarizing the global forces and for telling us about the 5 key recommendations or ideas for action. As you said, the paper is on our webpage. So if you go to, events and you click on, this event, you can access the paper. But let's get started with, the panel. And first, let me, ask Lumbe. Well, first, welcome to our platform. And I think the key question that we all have is, given the changes that we've seen recently, are these recommendations still relevant? And if any, which one would you prioritize? Over to you.
Great. Thanks very much. And thanks for the introduction. So I think, as Prashant has said, one of the key points from our perspective is really understanding the patient journey. So while I think all the parts of the paper are important, I just want to start us off with the client centricity or patient centricity aspects. And just to bring in a little bit of a dimension of complexity to this patient centricity. As was said in the introduction, populations are growing, populations are aging, they're changing disease patterns. So healthcare needs are also changing. And countries are generally succeeding in containing costs, but we know that costs are going to expand because we're going to be dealing more and more with multimorbidities. So both communicable diseases and non-communicable diseases, hypertension, diabetes, and so on. So budgets are going to, as much as we try to contain them, are going to be expanding. But what this means also is that when we look at care models, integration becomes more important. And when I speak of integration, it's on the one hand, yes, the vertical disease programs, but then also integration of care within the current model, the current health facility model. So when you have a patient coming in, the patient pathway really has to take into account the life cycle approach. So integration of care becomes important. And what we've seen countries doing is really having a case manager who is responsible for coordinating care for particular patients with multimorbidities, which we're seeing more and more. And I think countries like Eswatini, for instance, also have client management information systems that do the same thing, but in a digital manner. And so what this means is that we also need to start thinking about how we're integrating this care from a supply chain perspective, and I'm speaking very much downstream, with commodity managers who are able to navigate these multiple supply channels and ensure patients have the capabilities that they need to have different types of supplies when they need them at the times that they need them. And so it's going to move from a sort of static interaction with the facility to a more continuous interaction with health facilities. And I think this function of commodity manager is going to become more and more important. We've also seen that supportive supervision of health facilities really helps improve the quality of care, and is also going to help improve availability of supplies. So including commodity managers in supportive supervision is going to be important. So that's one aspect on integration of care at the facility level. Now, integration also means both medicines, but also other commodities, other health products, vaccines, therapeutics, and diagnostics. So we also need to think about how are we integrating these supply chains to make sure that, once again, patients are not being forced to have different touch points with the health system in order to get the screening, prevention, and treatment that they need. So I think moving forward, the integration role is going to be important in terms of containing costs, in terms of making that patient journey more streamlined, and in terms of also improving forward-looking how we're going to design more of the downstream supply chain systems. But so really starting with understanding the current patient journey is going to move us forward into where the paper really speaks to the individual type of care for patients. I'll stop here for now.
Thank you very much. I take from you two key points. So patient-centric, still key and important, and integration on all these different facets, all the different facets of integration that you mentioned. Thank you. Prashant, let me come back to you because there's something that you didn't speak a lot about, and I think is key, and is, what role does policy and regulation play in shaping the future of global health supply chains?
Thanks, Javier. I will talk about probably two things. Again, it cannot be a comprehensive answer just because the nature of policy for supply chain can be a fairly vast agenda item. But let's talk about quality regulation first, which is an area which you know very well about, and you and I have had numerous discussions, Javier. Supply chains have to internalize the fact that supply chain design cannot be separate from how quality regulation happens. Right? If we do that, we are going to rule out some supply chain models completely. So if we want to have more decentralized supply chains, if we want to have a system where health clinics and health facilities have choice in where they source their medicines from a central medical store, from a private wholesaler, from another source, then we want to make sure that the quality of medicines they get, irrespective of the source they choose, is high quality, efficacious, and all of the safeguards that we want in quality are built in. In order to get there, we need a strong enforcement capacity amongst national drug regulatory agencies. This is a hugely neglected agenda, and unless we get together and call this as a clear collective action problem for supply chain and procurement, it will not get addressed. And without it getting addressed, we are going to face a challenge where some types of supply chains will never be acceptable because of the risks they present on quality. So that's one, quality at the national level, enforcement agenda, equipping regulators for enforcement. The second is quality at the global level. We've seen many instances where low quality, or in some cases illegal supply of products that should not have been on the market has reached, both for prescription and for over-the-counter drugs, in countries in Africa region and in many other parts of the world. Right? And many of these suppliers, we know about their history of poor quality supply. So if we had gone and created a system where we could look at their poor quality in the past, we would have prevented, or at least provided, a risk score about those suppliers' quality to the purchasers, which are ministries of health and procurement departments. So that's the second part, which is, can we do something on global quality beyond what is done under the pre-qualification program or other such measures? Because the fact is a large majority of health products that a country purchases aren't a part of what comes through in the scope of the pre-qualification program, right? So we need a different way of thinking about how to ensure quality. We can't have a foolproof method that easily, but at least there are some clear, simple steps that need to happen. Then is a policy item about tariffs. Many low and middle income countries still have tariffs and import duties on health products. And if you talk to Treasury, it is a means of revenue for some of the countries. But then if you ask the question, you take money from tariffs and say you are contributing to the national budget, but then you have to pay it back because those are things that have to come out of your health budget. How does this equation pan out? And again, it will change a lot. This set of discussion will change a lot as we start to see many countries in the LMIC bucket get bigger on local manufacturing, because it oftentimes is thought of as a lever for enhancing local manufacturing. So I think that's a policy item where the answers are not straightforward and not clear, because we can't neglect the economic consequences and only look at the health consequences. The health consequences of tariffs are not necessarily good, that we know in somewhat meaningful manner from various studies and collected evidence. So tariffs is the second part. And then the last thing about policy is for ministries of health in countries to think about what is their policy instrument for being managers of their supply chain versus operating their supply chains, right? And then there is a distinction between being the manager of the supply chain and operating it. So can they use policy instruments that allow them to become better managers so that they can answer the population, their constituents, their minister, their head of state about issues related to supply chain management when failures happen, but they don't have to necessarily own their truck and send it out themselves. And that is a policy instrument which we've seen examples of, but we don't unfortunately make sufficient progress on where it is applicable, how it is applicable, and if it needs to change, let's have an honest and candid discussion about what needs to change for that role to become effective.
Thank you very much, Prashant. Areas of, problems of collective action, the need for, global public goods. I think what you said about going beyond the WHO pre-qualification to basically have this global public good that will allow us to improve qualities is a very important idea. Tariffs and being managers. So thank you. All very good points. Philip, let me turn to you because one of the key recommendations that you guys had talked about localization. And I want to understand how can we better integrate local, regional, and global supply chains to enhance global health outcomes?
Thanks, Javier. I think my fellow panelists already touched on several important points about how this integration can be achieved, or at least how it can be improved. So let me try to build on that with a few additional reflections that I noted. So we know that there are a number of enablers that can make a big difference. For me, first and foremost, it's about getting better at using data, not just in the way that we collect it, but actually connecting data. So there are existing solutions out there like digital, shared digital platforms for things like demand forecasting, for things like inventory management, and really tracking products from factory to the clinic, from factory to the patient, actually, that can give us the requisite visibility across the different levels of the supply chain to allow us to plan better, to act faster, to avoid stockouts, to respond more effectively to crises, and so on. And obviously, new technologies, AI, blockchain, machine learning, they all offer some really exciting opportunities to make existing systems both smarter and more interoperable. The second one, and I don't want to really repeat what Prashant just talked about, but supply chain integration isn't just about technology and logistics, it's also about policies. And Prashant mentioned harmonized regulatory policies and harmonized regulatory standards and how they can help streamline cross-border trade, how they can also enable and perhaps even encourage more integrated collaborative procurement models, and at the same time maintain consistent quality and safety of health products. In the position paper itself, we've highlighted a few other additional important opportunities for integration. So we've talked about establishing shared regional manufacturing hubs. We're talking about potentially building shared strategic reserves or establishing exchange mechanisms for medical countermeasures. And we're also saying that we shouldn't overlook the potential of better integrating public and private health supply chains. And there are a bit more innovative risk-sharing models out there that are being deployed, like reagent rental contracts or managed equipment services and the likes, that allow this risk-sharing and that integration to happen. But for me, just here's my key point is investing in health-specific supply chain solutions is important, but it's probably not going to be enough. And as Prashant also mentioned earlier, we know that health supply chains, they don't operate in a vacuum. For them to work well and to be truly resilient, we need to look beyond just the health sector and take a broader, if you will, multi-sectoral approach, especially those of us who work in governments and organizations that have mandates, let's say, that transcend health. So if we think about transport, it was mentioned, without reliable roads, without reliable ports or logistics networks, even the most efficient procurement system won't get the products to the patient. And the same goes for energy. A consistent power supply doesn't just keep the lights on in the health facility, it's also critical for vaccine cold chains across all levels of the supply chain. It's about running diagnostics. It's also supporting local manufacturing. And again, in the paper, we mentioned a few others like advanced communication networks, effective trade facilitation policies, customs harmonization. They all have a very direct and substantial impact on how health relevant goods move through the supply chain. So the message here for me is when we invest in these, I don't know how to better call them, but foundational systems, foundational sectors like transport or energy or digital infrastructure, we also to a certain extent invest in public health. And one thing that we argue in the paper is that procurement and supply chain management is critical to health equity, but is often missing from global health investment strategies, especially in the low and middle income countries. And we're calling for a stronger voice of procurement and supply chain management experts in the health sector planning and policy making. But I would even go perhaps one step further and say we need that same voice also at the table when investment decisions are made in these adjacent sectors too, because they do directly affect the ability to deliver health for all. So I think, I'll pause here.
Thank you very much, Philip. Anyone else wants to comment on that key question about, integration and integrating local, regional, and global supply chains? Philip talked about, technology and a multi-sectoral approach. What else? I mean, do you want to reflect on this particular point? Yes, Mif, go ahead.
So just a quick comment. I would say that as we reflect on local, regional, and global supply chains, I think we have to acknowledge that the global supply chain will become less important than what it has been when it comes to global health. And we have to recognize that as the shift of global mechanisms, especially around procurement and planning, are probably more relevant in the regions and in the countries themselves, depending on what products are being procured, who's procuring, and so on and so forth. So I think when we think about local, regional, and global supply chains, especially in the context of procurement and planning, we do tend to think more about the global organizations. And I just think we also try to raise that in the paper as well, that as we move forward, many of these supply chains are going to have to be sovereign-led or will have to have more of a regional focus, which also requires the regulatory and the policies to support that as well too, and the capacity, obviously, of the different organizations and markets. Over.
That is a very, very important point. We've thought about supply chains, in the past 2 decades as a global exercise in a lot of cases. So thank you for highlighting that about that future changing. And since I'm with you, can I ask you a bit about something you said in the paper, which is, investing in capacity to manufacture diagnostics, vaccines, and therapeutics. Do you think that will help improve the supply chain, or do you think that will make it more challenging?
Thanks for the question, Javier. It's an interesting question, and one that you could talk for quite a long while actually about, but I'm going to try to simplify it. I would suggest that building capacity for manufacturing will both help to improve procurement and supply chain, but also highlight the challenges that we're currently seeing in many countries and many regions that need to be addressed to enable us to do more local and regional manufacturing. When we talk about manufacturing, we tend to talk about vaccines, drugs, and we also need to consider that there is a lot of manufacturing activity that's also going on with products like lab consumables, glassware, plasticware, purified water, and so on and so forth. And so when you have a conversation about that, it's a little bit different to having a conversation for setting up vaccine manufacturing. But I do see it provides an opportunity to improve the end-to-end supply chain, as both Prashant and Philip have talked about, and Lambe has referred to as well. The supply chain is everything from inputs to manufacturers all the way down to when it actually gets to a patient. So I think local and regional manufacturing really does provide this opportunity to improve the end-to-end supply chain. I think it helps to improve the capacity for actual manufacturing, but also capacity around planning, risk scenario planning, better use of data analytics. I think it can also help to improve the logistics ecosystems across the continents, whether it's in Asia or whether it's in Africa. I would say, however, though, and just as we had talked about the procurement capacity as well, too, because that does need to change, too. So there's local manufacturing will also help to improve the procurement capability, again, whether it's pool procurement at a regional level or whether it is in-country procurement or subnational procurement. I do think some of the challenges that we face and we should not be ignoring is infrastructure, so reliability of water, electricity, and also as well roads access. But more important, I think one of the biggest barriers that we're seeing at the moment is cross-border movement and the regulations and tariffs that are preventing that. I know many of you, and sorry, I'm talking specifically about Africa at this point, but I know many of you will travel to East Africa, and you literally, to go from one country to the other, you have to travel back to Europe to go back to West Africa again. And there's many examples of where the cross-border movement is just extremely challenging and does not lend itself to the movement of products that are locally or regionally made. Given that I'm in Ireland, I do want to use Ireland as an example. Many of you know we have a very strong pharmaceutical base in Ireland, and the reason that we have that is from a procurement and supply chain standpoint, we had a very strong procurement and supply chain logistics network in place, capacity, logistics lanes, transportation lanes, and so on and so forth, because of the high-tech industry. And the pharmaceutical companies were able to build on that. And we had very strong infrastructure in place as well, not just from a manufacturing standpoint, but also for an exportation standpoint. I don't know if many of you know, but we are the third largest exporter of pharmaceuticals in the world. And pharmaceuticals is about 38% of our trade export. However, this has been successful not just because we're building on the expertise that already existed, but the fact that our government had created the right incentives from a tax standpoint, from an education standpoint, cross government departments to ensure that these different industries could be successful in Ireland and could continue to contribute to employment and education for the Irish citizens. I think also as well that we have to be very aware that it did not reduce the price of medicines in Ireland. The Irish market for medicines is only about 5 million people. And so our prices for medicines were not lower because we were doing manufacturing in Ireland, because the majority of them were exported. And now this week, we are going to be hit with 25% tariffs from the US because of it, which will totally upend the industry in Ireland. So there's stuff like this that we also have to be very cognizant of. And I think that, yes, we have an opportunity to use manufacturing to improve the end-to-end supply chain, but we also have to be aware not just of the current challenges, but of the future challenges, and ensure that we are continuing to do these kind of risk analysis, scenario planning, and so on and so forth. And Javier, I believe Philippe and Lambe also have some, key comments on this particular area as well. So I'll hand over to them too. Thank you.
Philippe, thank you, Miv. Please, Philippe, go ahead.
Thanks, Javier. And yes, just before we jumped on this webinar, we had a discussion around the Ireland case, and I told Maeve that there is no doubt that investing in local manufacturing that can bring important benefits, right? And we know that there is opportunities to improve access, there is opportunities to strengthen supply chain resilience. It can have economic, it can support at least economic growth, and we see a lot of examples here in Asia, right? Powerful examples with not only China and India as kind of global leaders, but even countries like Bangladesh or Indonesia or Vietnam. But while this momentum is positive, I do think we need to be a bit careful about how we pursue this. There is a feeling that local manufacturing is a silver bullet, right? The idea that every country should now become fully self-sufficient in producing all essential medicines, all essential health products sounds appealing, especially in light of the recent supply chain shocks. But in most cases, it's neither feasible nor necessary, because we know that pharmaceutical manufacturing is complex. It demands scale, it demands high levels of technical capacity, sustained investments, and so on. And we do see that some of the smaller markets, they do struggle to viably and profitably produce at competitive prices or meet international quality standards. And Prashant mentioned earlier tariffs, and yes, there are industrial policy tools, subsidies, tax incentives, preferential procurement. We see that a lot. They're all legitimate instruments to support local production, but they need to be used with care, because we have seen that if they're not well designed, they can backfire very quickly, leading to higher prices, oftentimes limited product choices, product options in countries, or even undermining some of the public health goals. So I do believe that we should be strategic about local manufacturing. Instead of every country going it alone, I would advocate for a more sustainable path, in my view, that is regional collaboration, shared investments, developing perhaps specialized regional manufacturing hubs. We talked about harmonizing regulatory standards, aligning procurement practices. So all of these can make this work. But I would say the goal shouldn't be national self-sufficiency at all costs, but rather smarter, regionally integrated manufacturing that's aligned with public health priorities. That, for me, is how supply chains can become more resilient. Just a couple of reflections from my side. Thank you.
Thank you, Philippe. Lombe, what do you want to say about this?
Yeah, no, I think Philip has said it all, really, but just to also add from an R&D perspective, I think there's some opportunities. I spoke about client centricity. I think there's some opportunities to do some research and development on the packaging side, because I think some of the challenges with really getting the right product to the right place at the right time lies with the way they're packaged, the way the secondary and primary packaging is done. So there's some opportunities to look at green packaging, but then also packaging that really responds to the client needs. So based on the particular condition, month-to-month dispensing, and so on. So a lot of opportunities, perhaps, if we look broader at the manufacturing sector on the packaging side, and then also, as has already been mentioned, opportunities to leverage this momentum to improve the overall ecosystem. So improving regulatory systems, improving skills building, revisiting tariffs, and so on. So just wanted to add that as well. Thanks.
Thank you. On this topic of local manufacturing, we have done a lot of work, so I invite you all to look at, our work at CGTEF, but we will also be releasing more research and analysis on, the goods and bads of local manufacturing and the supply and demand considerations. But let's move now to Seife, who's been a bit quiet today. I'm sorry for not engaging you earlier. I've got a key question for you. I mean, you are in Ethiopia, and I want to understand, what you believe are the most important priorities for countries for the future of the global health supply chain by 2040, and why would you say that? Over to you.
Thank you, Javer. I think, as you all were mentioning, it is clear that how those challenges would be a little bit significant for low and middle income countries like Ethiopia. So for that matter, we have to prioritize as much as possible to intervene those challenges. Basically, this is to, prioritizing represents a roadmap toward a more equitable and effective global supply chain system. So for that matter, there should be things that we need to consider, like resilience in that aspect to create a sustainable system within that territory. So for that matter, the urgency of this resilience cannot be basically overstated. So as an experience, we all know that what happened during COVID-19, how it affects the supply chain system of the global. The fragility of global health system in that case can be explained. And of course, you also mentioned the climate change also would contribute for the disruption of the supply chain, not only in developing country, but rather all over worldwide indeed. So strengthening this resilience involve, diversifying, as you mentioned, the suppliers, decentralizing production, and ensuring the robust emergency preparedness plan is one of the most important perspective in that way. So collaboration, as you mentioned, also across the border to anticipate this disruption and to recover immediately would help us creating such kind of thing. On another way, the digital thing that we are mentioning is the most important part, particularly recently, of course, in countrywide, the ERP system was established where, which would help us for traceability of products to the lower level. So you also mentioned, the AI, which would also help us for demand forecasting. It's still important part to just tracking and to revolutionize the supply chain system. So this also, help us to reduce the inefficiency that we are facing, okay, in low and the middle income countries. So which will also help us to enable data-driven decision making in that aspect. So it also increase, as it has been mentioned, the transparency where we can ensure the right product to reach the right people at the right time. So in that aspect, it also help us. The other part is patient-centric supply system. Particularly for, where we could get inequalities of targeted intervention to reach the marginalized population. We need to design how to build up like for last mile delivery system using different cooperation systems in that aspect, like government and NGOs and the private sector should also ensure the alignment for those challenges. The other and the last perspective, which we probably need to prioritize, is collaboration. Of course, as early mentioned, collaboration, reduces the dependency of these developing countries, where it could create a localized solution to boost the challenge that we're facing, right? So as it has been mentioned, regional manufacturing hubs, like which would also help us for joint procurement program, is not only improve the efficiency, but also it fosters the economical challenge that we are facing right as well. So those are very much important to stabilize and to just settle in prioritizing this situation. So for that matter, the cross-border cooperation is in this aspect is very much important, and it's critical point that we need to take to minimize the challenge that we are facing. So these critical points are, basically not, it's not something that we need to look independently, but it is interchangeably where we need to, interconnect it for, vital and to achieve the sustainability things that we need to, to create the ownership with this aspect as well. So that is somewhat important to bring the transformative improvements that we are looking in that aspect. Back to you, Jaber.
Thank you very much. And let's move quickly to some questions from the audience as time is running out. So we've got a question here about transitions. So what transitions are foreseen as a gate to the new way of financing global supply chains, mainly for low and middle income countries? I think we mentioned a few transitions, but anyone interested in talking a bit more about that? Transitions that will be seen or can be foreseen as gates. No, not so much to say on this one. I guess we talked about, already some transitions. I mean, moving away from global, the need to have domestic manufacturing, as in a very thoughtful manner, not as a silver bullet. But let's then talk about last mile and underserved communities. We've got a question about key interventions that you would advise to prioritize and strengthen supply chains to reach those last mile and underserved communities. Any comments on that?
Yeah,
yes,
I'm happy to make a quick comment. I think building on some of the stuff that Sefi said and also my other colleagues earlier on, for me, when I think about last mile, it's about the patient, right? So it's really understanding where the patient is, what the patient wants, how they want to receive services and that. So I think the whole patient centricity, and actually in supply chain, we tend to think about how do we get products to certain places. We need to change that dynamic. We need to understand where the patients are, where they want to, and it's not all patients, but where the citizens are, and where do they want to access services or access products, and what makes the most sense, and then build out the supply chains to support that. And I think as a part of that, leveraging both public and private and faith-based channels are important to that. It isn't just public health channels, or it isn't just private sector channels, but it is leveraging all of those. And I think as we go forward, we'll also see that the digital channels will also become a key part of that as well. So I'll stop there.
Thank you. As we come to an end, I just wanted to ask you all for a 30 seconds reflection to close this interesting conversation. So please give me your takeaways and please give our audience our takeaways. Philip, can you please get started? 30 seconds.
Okay, I'll just very quick, and probably this is a very biased view from where I'm sitting, but I think I'm excited about the potential that regional solutions bring about in terms of addressing some of these forward-looking risks, but also leveraging some of the forward-looking opportunities that the paper has identified. And we talked about regional solutions to procurement, to manufacturing, to harmonizing quality assurance. So that's kind of the prospect that excites me most.
Thank you. Prashant, 30 seconds.
Three things very quickly. The first is whether it's on the manufacturing agenda or other things, we can't think about logistics, procurement, manufacturing to be separate decision points. The more we continue to do that, the likelihood of failures is larger, because manufacturing without procurement without logistics, like those things just don't work. We've got to get that right. The second is the center of attention here has to be the colleagues at the Ministry of Health who have to deal with both procurement, distribution. And we have a model of capability building, or TA as we call it, that is completely flawed. And we need to change that dramatically and meaningfully. And that should be the first and foremost task in front of the global and the country supply chain community.
Thank you. Lombe?
Yes, I mean, this has been a great conversation. As we've said, government resources for healthcare are really being constrained for many reasons, including, limited tax revenues, high levels of debt, economic shocks, and so on. So, and then at the same time, there's a lot of pressure to spend. So I think the resilience piece in this paper is particularly important. And I think addressing this also means looking at countries that have already reached 2040, so to speak. So we have some models in different countries, Indonesia and so on, that we can pick from, where we can improve this resilience, where we can improve this efficiency, and where we can try and contain some of the costs of supply chains more broadly. And I think the localization piece is particularly important to achieve that. Thanks.
Thank you. Seife?
Okay, thank you. I think collaboration is one of the most important parts that we all need to consider in this aspect, particularly like engaging the private sector, because when we think about the government, there might be a big limitation with resource-related things. So engaging the private sector is the most important thing to share the challenge that we're facing right now. So collaboration with different entities which are, responsible to manage these all things are somewhat very much important.
Thank you. Meet, you have the final word.
Thank you so much. So I would say innovation is a big part of the future for everybody, and I think it is very critical to global health. I admire the LMICs for their ability to adopt it very, very quickly, much more so than I see in developed world. And I am excited for the ecosystems to grow in such a way that innovation can be scaled sustainably. And with that also, I'd like to thank my colleagues as well, too, for this interesting conversation today.
Yes, well, thank you very much. So it's been a pleasure to have you here. Thanks to our audience. Clearly, the conversation today highlighted the fact that the forces that you went through as, in the process of putting together the paper are here to stay. Change is here to stay. And invite our audience to look at the paper, reflect on the changes, and think of the 5 recommendations, as well as the keywords that we mentioned here: integration, innovation, localization, private, public sector. And what Prashant said, it needs to be, always risk assessment. So thank you all very much, and have a good day. And please stay connected with the Center for Global Development. Have a good day.